Hi there, I'm Darryl Foy. I'm one of the co-founders of Dialog Digital Health and co-author of the dialog.fit app, which has been interrupting you in this past couple of weeks by asking you for a little bit of feedback. We're very grateful for the feedback we have got. It's much appreciated. It's invaluable. When you design and engineer something which is ostensibly there to try and make a difference to the way people manage their health, and in so doing make your life a bit easier, potentially more profitable, then we'd be silly not to listen to your feedback. So I'll just summarise it very quickly. Basically in order of popularity of feedback topics. The first and foremost was a question about pilot. How do you as a clinician engage yourself and a couple of your patients in a pilot? It's pretty simple. It's free to you, and it's free to the patient or client, and all we need to do is help you set up your services so that it's free for 4 or 6 weeks, so completely free to use. We're not going to make any money out of that, are we? But we really want to make believers ahead of customers, and so let's start with that. The other question was around when people can meet me and perhaps Craig face to face, and I'm going to be in New South Wales, Queensland, Victoria and Tasmania towards the end of July, and I'll lock down some dates there, and I'm going to be doing some demonstration of the apps and some training in some of the other devices and things like that, and just be there to have a cup of tea and ask a couple of questions and listen to your ideas and all the rest of it. So here we go. So pilots, easy. Just go to the website, hit join, email us, we'll make it happen for you in a matter of minutes. Landing page. Yes, it doesn't really tell you enough, does it? Or it's the main feedback there from Ian here says, looks quite techno and a bit intimidating. Maybe make it a little bit simpler. And from Natalie, would be really nice to have just a simple video introduction and then a couple of screens which show you how to get started. So that was pretty consistent. Most of the comments were pretty similar to that. I think that's fair criticism. Craig and I have engineering backgrounds. And of course, I've got health science and all that other stuff as well. But yeah, we tend to have made it a little bit not as obvious as we probably should have. So apologies for that. And along those lines, we've created a new explainer video, a couple of them actually, one of them which will be used on site with our spokesperson, Amanda, and that's going to be rolled into a new landing page which is a lot fresher, a lot simpler. The video just explains in a minute exactly what you're there to do, why you want to use it, and then the next screen will show you how to get started. So fantastic feedback, thanks for that. Someone asked me, is there help? Yeah, there's help. You go onto the cog on the main menu and go down the bottom, there's an FAQ and help, and that's reasonably comprehensive, if not a little bit dry. I'll be adding some screens to that next week to make it a little bit more interactive. Plan. Pretty much everyone really liked that. One of the things about Fitbit's fantastic for tracking data. We're Fitbit fans, obviously, but we also want to provide something which allows you to really simply specify activities, durations, and workout zones for people pretty quickly, and to be able to do that and share it instantly, adjust it instantly, and that's what planning does. So people really like it. A couple of suggestions. One from Jaden, would be great to see some facility for adding reps, sets, rests, intervals, all those sorts of things Couldn't agree more. We've specified that already. It's a matter of coding and testing that. And from Katie, why can't we add videos for each particular exercise, whether it be rehabilitation or conditioning, to the plan? Yep, brilliant, love it. A couple more people asked the same thing as well, and we've specified that as well in Plan 2.0, as we call it, and we hope to have that integrated in the app pretty shortly. We'll let you know how soon. Medicare payment processing. Can we do that in the app? It's a big ask. The answer is yes, we can. Yes, we can, but not today. Our main constraint there is financial. We can do it technically. Craig can do that. Clever engineer that he is, quite seamlessly and make it all part of the payments process. But we're just a wee bit hamstrung by cash at the moment. But that's on our to-do list for the next few months. And yeah, as soon as that's ready, we'll let you know. Okay, cheeky Brendan wants to know, well, where's the machine learning? Good question, Brendan. Smoke and mirrors right now, my friend. But yeah, I've been saying this for about a little while, that we'll have something useful to you in a few weeks, maybe sooner than that. The trouble with, you know, look out for people go, oh, machine learning, AI, ooh. You know, two things. One, you have to have a large body of data if you want to be able to predict and explain associations and outcomes. Okay, that's basic maths. And so we need to stick in the egg. The more people we have using the system, the more accurate and relevant will be our predictions and explanations. And we're not just plugging into some UI GUI thing on the web. This is all native R program, R source code at the back end, and so it's serious stuff. And that's one part of the difficulty. The other thing is we need to be able to present it to you and your patients and clients in a way which is like simple, plain English. This is where you are, no judgment attached by way of a visual cue or anything. That's just where you are in terms of your outcome in relation to your effort. And this is where you're likely to be if that continues. And by the way, those people who have the best outcomes have these behaviours and these exercise prescriptions. And so, sounds simple, but presenting it in a simple visual or a single sentence is one of the truly tough art forms that we've encountered. That said, we're not stupid and we're going to make it happen. Next one, Scott. My Apple Watch and my Garmin patients, it's no good to them just yet. Correct, my friend. I'm not going to press a button and make it correct for them by tomorrow, but again, it's not so much a question of engineering effort, it's a question of how many people in your clientele have Apple Watches and Garmin's versus Fitbit. We'd like to know. Tell us. That's the only way we can drive those developments, because we can do it. And we're already doing a lot of preliminary work in the Apple Health Kit space. And you'll see more from us in the next few months. But definitely, Scotty, it's coming, and hopefully before Christmas. Sonya, the electronic health record integration. Yep, that's really important. That's not hard. It's not a hard thing. Just a question of everybody in the provider and public health space being more or less aligned at the same time so that we've got enough people who will use it. Simple as that. The functionality is one thing. That's not dramatically complex. It's a question of who's going to use it, how often will they use it, and why would we do it for 3 or 4 people. But it's absolutely our intention to integrate it with the Australian e-health system. It's not hard. It's just a matter of getting enough providers and their patients interested. Consider it done. But that's it. I want to keep it brief. I'll send a link to our or not. I will send you all a link to our new video if you need that. But yeah, look, Daryl at dialog.fit, D-A-R-Y-L at D-I-A-L-O-G.fit. That's where I am. Send me an email. Got ideas? You want to get involved? That's fantastic. If not, respect that 100%. You have enough spam in your life. Don't need me adding to it. But thanks for your time. Talk to you later. Cheers.